I just need a moment. That is actor Eric Dane. Recording his last words for his daughters before his tragic death last week from ALS. Now, he passed at 53. And now many people are asking a simple but really urgent question. What is this disease? Could it affect anybody? It's robbing people of movement, speech, independence, and ultimately lives. So to help us understand the facts, we're going to be talking this hour with Dr. Derk Krieger, who's consultant neurologist in Dubai. He's got decades of experience and joining us from Fakeeh. So I am so happy to have you with us, Dr. Derk. I find the fact that you work with brains absolutely fascinating, to be honest. And we are going to be talking about this devastating neurological condition. But before we delve into definitions and diagnoses, can I ask, if people do want to get in touch with any questions around their brains, what is keeping you busy in clinic right now? What are some of the conditions or concerns that you're helping patients with?
Thanks, Helen, to have me again here.
Pleasure.
And thanks for the question. Yes, my clinic is devoted to neurodegenerative disorders lately. I have done everything in my career, but over the past 5 years, I have been more interested and more willing to treat patients with these devastating neurodegenerative diseases, simply because we have now treatments available for these people. Mm-hmm. And I would like to make a difference for these people's lives.
I think it's also interesting that we are increasingly having an aging population in Dubai. We're having people retire here, stay here longer as well. But it's not just about an age, as you say, these are conditions that you're treating, but you can be treating someone early in life who've had a diagnosis as well. And I think that, honestly, hearing those words from Eric Dane, passing at just 53 years old, and the clarity that he, comes with the end of life, it's just so heartbreaking, and we are going to be hearing more from him later on in the show. But what are we talking about when we're talking about ALS, about motor neuron disease? And forgive my ignorance, are they the same thing? Are there differences? Could you clarify for us?
Yeah, ALS is like a premature aging and failure of motor neurons. And motor neurons, this is what's called motor neuron disease, are the big cells in the spinal cord as well as in the cortex that have very long axons that connect each other. So when you make a motor impulse, you want to move your hand or something, it is generated all the way up in the cortex, and then it travels all the way down into your right or left hand. And that's like a meter or so. And those axons are very long and very vulnerable to diseases such as ALS.
Is it common? Is it rare? Do you think it's becoming more common? Do we have any stats on it?
What you just said is important. Dubai has an aging population, so it gets a little bit more frequent with age. And also, aging population means that a lot of expats stay in Dubai. I think in like 10 years ago, it was relatively rare. But now that we have an aging expat population of 10 million people now in the whole country, you can say it's about 4 to 8 cases per 100,000 people. So in Dubai alone, there should be 200 to 400 patients.
And they should be coming to see you. Can I ask then, you mentioned there about kind of that brain reaction connection. What are some of the earliest signs that people might notice with motor neuron disease, and why could they be missed?
Well, they can be missed because they're very subtle. So, for example, Eric Dane's tape showed that he's dysarthric, so he's slurred speech. And this starts very, very subtly. And you don't necessarily notice this immediately. And the same is true for other parts of your body, like the hands and the legs. It's not that you all of a sudden paralyzed. It just happens very, very slowly. And that's why it's so difficult to diagnose in time.
So how is it diagnosed? Is there a single definitive test? Is it you sitting down and interviewing someone? Are there brain scans? How does it come about?
It's a combination of those. I mean, you have to rule out things because there's no particular test yet available for ALS. So it's usually a second opinion, third opinion kind of thing. And that's why it takes time for the diagnosis to be established.
And then once diagnosed, how quickly does the disease typically progress?
unfortunately, it's about 2 years. Patients have about 2 years after diagnosis. So depends on how long it takes for them to be diagnosed. They may have already eaten up a lot of this time.
Gosh. And I think that's what I've seen so shocking. Obviously, Eric Dane has been in the headlines because of his passing last week. But, I grew up in the UK and there was a wonderful rugby player called Derk W that I knew through the rugby club and, just through being around in our neighbourhood and in the community. And it's just so heartbreaking to see someone who is so physical and vital. And Derk W was massive. He was about 6'6" and, lovely, farming family guy. To then become, that life become and that body become so much smaller, and so quickly, as you say, 2 years is just absolutely devastating. It really is.
Fall in love. Not necessarily with a person, although I do recommend that. But fall in love with something. Find your passion, your joy. Find the thing that makes you want to get up in the morning. Drive you through the entire day. I fell in love for the first time when I was about your age. I fell in love with acting. That love eventually got me through my darkest hours, my darkest days, my darkest years. My work doesn't define me, but it excites me. Find something that excites you. Find your path, your purpose, your dream. Then go for it. Really go for it. And then choose your friends wisely. Find your people and allow them to find you. And then give yourselves to them. The best of them will give back to you. No judgment, no conditions, no questions asked. Hang on to them. They will entertain you, guide you, help you, support you, and some will save you.
Tough listening there. Eric Dane, the actor best known for his role in Grey's Anatomy, recording his last words for his daughters before he passed away last week at the age of 53. Now, ALS, motor neuron disease, are terms that we hear, more, of course, when a high-profile figure becomes ill. But most of us, myself included, actually know very little about what is happening in the body and the brain, what a diagnosis really means. We've been talking this afternoon, and staying with us to answer my questions and yours is Dr. Derk Krieger, globally experienced neurologist, former professor of neurology, and he is practicing at Fakeeh University Hospital. What do we know, Dr. Derk, about what causes ALS? How much of it is genetic versus environmental?
It's a good question. We don't know. We understand the pathophysiology of ALS quite well. Unfortunately, we cannot interfere with it successfully yet. But nothing of this seems to be straightforward. There is a genetic disposition to it in some way. There's like 2 to 5% genetic cases. So yes, of course, you're going to go for a genetic panel and see if you have one of those few. And actually, there's a treatment available for one of them. However, most of them are, I wouldn't say environmental. I think it's an unsuccessful aging of the motor neurons.
So, but are there any particular groups who might be more susceptible then? Well,
you hear it often in people who do sports, contact sports, and actually in the US it's called Lou Gehrig's disease after the baseball player, and so maybe that pitching, over many years has caused the trauma in his spine that caused his ages to change, but we don't know for sure.
You mentioned treatment there. In general, what is recommended to help slow the progression of the disease today?
Well, you always, in these neurodegenerative disorders, you always have symptomatic therapy and then you have disease-modifying therapy, and they are more or less successful. In ALS, we only have one disease-modifying treatment, and that is exclusively for 2% of cases with genetic background. So for 98% of the cases, we only have symptomatic treatment.
Mm-hmm. And then what kind of support then helps patients maintain quality of life for as long as possible in your experience?
It's mainly physiotherapy. Yeah. Don't use it, you lose it.
Mm-hmm.
Fight with every ounce of your being and with dignity. When you face challenges, health or otherwise, fight. Never give up. Fight until your last breath. This disease is slowly taking my body, but it will never take my spirit. You inherited resiliency from me. That's my superpower. You knock me down, I bounce right up, and I keep coming back. I get up again and again and again. Marxism like a cat, except a cat has 9 lives and I'm on number 15 easily. So when something unexpected hits you, and it will because that's life, fight and face it with honesty, integrity, and grace, even if it feels or seems surmountable. I hope I've demonstrated that you can face anything. You can face the end of your days. You can face hell with dignity. Fight, girls, and hold your heads high.
Now, beautiful final words there of actor Eric Dane, recorded for his daughters, and I do urge you to listen to it in full. It's really beautiful. It's really heartbreaking, and the truth of clarity at the end of life. He passed away at age 53 last week after a short battle with ALS, and we're talking about cognitive decline, protecting our brains as well. Dr. Derk Krieger is with us today, a consultant neurologist. He's a leader in stroke care, neurocritical medicine, answering my questions and yours. I wanted to ask you, Dr. Derk, with your decades of experience, and as I said, you work now, as we touched on earlier, about cognitive decline. We've been talking about ALS, but also, Alzheimer's, dementia. Is there anything that you do for your own brain that we could all learn from?
Well, let me pick one. Sleep. Sleep is very, very important. You have to really work on your sleep. And this is a big problem also in my practice, with patients that come with anxiety disorders and depression. Sleep is always lacking.
Why is sleep so important for the brain? What's happening in the brain when we are truly at rest?
A couple of things. One is you consolidate the memories of the day, weed through them, which are important, which are not so, which are the ones that should be replaced. And then the other, probably even as important issue is to clean the brain, to cleanse the brain from debris. And it needs to happen every day, and it happens only in deep sleep. This is the problem. Mm-hmm. A lot of people, they fall asleep, they take sleeping pills sometimes, but they don't really have that sleep where they initiate the cleaning process in the brain. And this is the problem.
When I've spoken to sleep consultants and coaches before, a few things have come up in terms of what they might call kind of sleep hygiene. So one is winding down, so lowering lights, giving your body those cues and clues that, sleep is coming. But consistency seems to be a really important part of it. Going to bed and waking up at roughly the same time every day. And I know sometimes you can have a nap and you can maybe have a bit of a lie-in at the weekend, but it's really interesting to think about that as being a building block, a pillar of our overall health. And you saying there that that's basically, integral to our brain health. I've had a message about supplements. Any supplements you like for brain health or function?
Well, if you want to go this route, first of all, vitamin D is important. This is very important, and it's very low in Dubai because people are always inside. So check your vitamin D levels is probably a good idea. I didn't believe it when I came, but it actually is really true. Mm-hmm. And then other things in terms of, again, sleep. We picked sleep today, and there is magnesium, which is very helpful in 500 milligrams of magnesium at night, maybe even combined with glycine. It comes as a combination, glycine, 3 grams, and 500 milligrams of magnesium as a sleeping pill or sleep enhancer. If that doesn't work, you can try melatonin. And then during the work days or during the times that you're awake. What I offer patients sometimes is either vitamin B or those substances in the mitochondrial cycles, in particular NAD, which comes as an infusion. But this is something that I have used myself, of course. Mm-hmm. I have tried it myself, and it clears you. If you're a little foggy.
I'm very foggy. That sounds great.
Yeah, this sounds good for you. Yeah.
Can I ask then, lastly, about the importance of brain function, the struggle, because I'm seeing time and time again, we're getting dumber. AI is taking away the struggle of the learning, of the creation, and in kids as well. So what about doing things to challenge our brain to future-proof it?
This is a very good point that I think this AI business, ChatGPT, is a disaster, because you don't memorize things anymore. You just find the button and just ask it again. I do this too. It's a disaster. We have to be careful with this. We have to memorize things. Back in the days when we had phones, we had to memorize telephone numbers.
01434 632 175, my best friend's phone number.
There you go. There you go. You're practicing already. But these are the things that, kids don't understand this. They just grow up with this virtual reality around them, and they just are they're not in the driving seat. They are the co-pilots.
It's too easy. No, I do think there is an awful lot to be said for the struggle. That's how I learn. That's how we grow. And you said it before about physiotherapy, use it or lose it. Dr. Derk, thank you so much for your time today.
Afternoons with Helen Farmer on Dubai Eye 103.8.
It's been great to have you with us. Don't forget, if any of these topics or experts would be useful to someone in your life, hit that share button and you can tune into Afternoons with me, Helen Farmer, live every weekday afternoon only on Dubai Eye 103.8.
You've been listening to a Dubai